I do think AI is going to be game changing for healthcare. And so it's critically important that one understands the people and process aspects of the work that's being done before you try to overlay any AI technologies.
Welcome to Technovation. I'm your host, Peter High. My guest today is Leo Bodden. Leo is the Group Vice President and Chief Digital and Technology Officer of York-Presbyterian, a hospital group that includes the teaching hospitals for both Columbia University and Cornell University. The group spans across 11 hospitals and 450 practices. Leo began his career with the organization as a volunteer while he was in college. The company has grown substantially along with his responsibilities across the 29 years that he's been in role. I look forward to hearing more about the transformation he's leading, how he sees hospitals changing with better technology, and how AI will be part of the future story of York-Presbyterian, among other topics I'm sure we'll cover. Leo, welcome to Technovation. It's great to speak with you today.
Hi, Peter. How are you? Great speaking with you as well.
Well, thank you. And I'm so glad that you're here. Leo, why don't we begin with the business that you're a part of, York-Presbyterian. Could you talk a bit about the organization in your own words?
Sure, absolutely. York-Presbyterian was created through the merger of what then was Columbia Presbyterian Medical Center and New York Hospital. The merger took place in 1997. We are the university hospital for both Columbia University Medical School and Cornell University Medical School. We're an 11 hospital system, roughly 450 practices across a 800 square mile coverage area in the New York Metro.
And you are the Group Vice President and Chief Digital and Technology Officer. Talk a bit about what's within your purview, if you would.
As the Group Vice President and Chief Digital and Technology Officer, I'm responsible for all medical technology in the organization, which includes biomedical engineering, imaging, the logistics associated with all equipment, so ensuring that our colleagues on the ground at the bedside have all the equipment that they need to support our patients. I'm responsible for all clinical applications for the organization. Core technology, so the CTO reports under my organization. Facilities, IT projects, whether it's small, minor projects like renovations, floor renovations, or room renovations, as well as major projects like new building structures, building projects for the organization. Transformation is also under my purview, as well as all the site leadership. So the site CIOs in the organization for the 11 hospitals roll up under me.
Thank you for that overview. Well, as you just alluded to, you have a kind of a balance between a federated model of sorts. You have the site CIOs across the 11 hospital system, as well as some centralized aspects to what you manage as well. And how do you think about what's best managed centrally versus locally, so to say?
Sure. So I really think about, what the strategic approach is for the entire organization. So things like core technology and really setting the commander's intent, and that's up to the CEO, and ensuring that that strategy is set for the enterprise is critical. Things like applications, things like our data centers and our cores, and then of course our operating models is critical that you maintain centrally. But then you really need to think about the size of our organization, because we've scaled as we have. Again, we merged as a hospital back in 1997. We were a two-hospital system. It's very easy to manage everything centrally when you're that small, but when you get so large and you have an 800 square mile area, you have to think through how you decentralize. And so you have to educate, you have to trust your leadership, you have to empower your leaders to lead and ensure that they're carrying and dealing with all the tactical problems that we may run into. The reality is that there's no human on the face of the earth that can get embroiled into the tactical issues of the day-to-day. And so it's critical that you have leaders that can manage through those events and those needs, while at the same time recognizing that there's an overall organizational strategy and structure that they have to abide by. So I do spend a good amount of time educating my leaders to ensure that we are as close to one standard, recognizing that there are some local needs that also need to be met.
Very interesting. A great description. And I wonder, You mentioned part of your responsibilities is a transformation program. I wonder, how do you define transformation in an organization like yours, and what are some of the key aspects of it?
Sure. So for transformation, and you hear transformation in healthcare all the time, the reality is for us, it begins with program management. I have business technology leaders and analysts who are embedded into the operations of the hospital. And so those individuals are working with our clinical operators and our hospital operators to truly understand what their workflows are, where the opportunities lie. These individuals are subject matter experts and really operational efficiency experts who, by being embedded in those teams, can help recognize where opportunities lie and then work on the people and process optimization, ultimately landing on where we may find some opportunities for things like AI or robotic process automation that can be leveraged in order to further optimize the teams on the ground.
Very interesting to hear that. You also noted that among your responsibilities is facilities, and I know your team is instrumental in creating what you refer to as the next generation of facilities. What does that entail generally, and how is technology woven into it?
Sure. And it's the facilities IT projects, which is anything that involves IT and biomed as part of all these major infrastructure projects. I think the biggest concern that I have with major and minor projects as it pertains to facilities is that you don't think in year terms, you think in decade terms. And so if, as an example, if you're thinking about a small project, a floor renovation, you're thinking a decade out, and what are the needs over the next decade that need to be supported for that program? If you're thinking about a major hospital building, as an example, you have to think 4 or 5 decades out, and what are going to be the needs for the organization, again, in not in a decade, but in 20, 30, 40 years, and ensure that you're minimizing the future changes or the future needs for whoever your successor or successors might be. And so I think that makes it a bit difficult because you really have to be forward looking. On the other side, I have amazing people who are super bright and get very excited about the new capabilities that could be introduced to some of these projects. And so I have to, in some cases, tamp down the excitement and remind my teams that, we don't want bright, shiny objects, right? If you don't need to automate a door or a window or even lights in some cases, let's not do that. Let's make sure that, we really think through what's necessary, not introduce bright, shiny objects as part of the plan.
And I know that's a philosophy of yours, that practicality pervades a lot of your thinking with regard to innovation. And I know from our past conversations, Leo, that it also pertains to artificial intelligence. You've noted that one can't take advantage of AI without defining the people and process implications first. I'd love to have you describe the rationale behind that, and what you have found to be some of the people and process implications that enable value eventually through the use of artificial intelligence.
Sure, absolutely. I do think AI is going to be game changing for healthcare. And I'm sure we're going to spend a little bit of time talking through how we achieve that. But the reality is AI, while, one could argue smarter, it's yet another tool. And so it's critically important that one understands the people and process aspects of the work that's being done before you try to overlay or introduce any AI technologies. Whenever we have started with a technology in the past for us, unfortunately, it's translated to failures for the most part. And if not failures, the findings translate to additional investments that were not included in our original projections, which is now, whenever I'm talking to my team, we are so incredibly focused on people and process first. And then, absolutely, if the technology makes sense, introduce the technology.
Well, as you noted, I'd love to hear some of the use cases you've identified for AI. What are some of those that really excite you, Leo?
Sure. What I'm finding, and so I'll give you a clinical and then an operational. We're finding more and more that there are great opportunities for early warning systems. in healthcare, we are generating data on our patients from everywhere. And unfortunately, across the industry, a lot of that data is not leveraged for clinical decision support. And when it is, you're doing it at a fairly local level. There are a lot of tools and technologies in the works as we speak. Some of them are already implemented, although in most organizations, probably in all organizations, not at scale for early warning systems, i.e., you now have all the information associated with a patient and you begin to make decisions or help the clinical teams on the ground make decisions to support patients that may be at risk. And so to really be focused on the individual who's at risk versus some of the other patients who are there and of course need to be monitored, but certainly are not in the position that some of our more at-risk patients are. And so I love the idea of having that capability at scale and being able to deploy that across the entire organization. And so I expect that in the next 2 to 5 years, these capabilities will be more prevalent. And then in 10 years is going to be a requirement. It's going to be an expectation. On the operational side, there are opportunities to help support workflows. And so this is one example where, if I'm not talking too much about the actual technology that was used, but when we began this work 5-7 years ago, we began from a technology perspective. And so we built out the logic, and then the system was quite capable, but it worked in parallel of the actual people and process, i.e. the workflow. And unfortunately, the adoption was negligible. We made an adjustment thanks to one of our very senior leaders in the organization, where she recognized, hey, if we embed this capability into our current workflow, our people and process, it'll be far more significant than it has ever been. And what we have found is that by doing that, by working on the people and the process first, ultimately aligning that technology with the people and the process, we're seeing great dividends from an operational perspective, i.e. things like, estimated discharge planning and discharge dispositions for our patients, and helping our colleagues on the ground, our clinical colleagues on the ground, make better decisions from a more holistic perspective, which is where AI makes perfect sense, right? It can see everything that folks on the ground can't see. And then if you embed it into their already fairly complicated process that has been optimized, then that partnership will return far more dividends than if you did it separately, or if you started with the technology first.
Very interesting. I appreciate you sharing those use cases. And it's interesting in hearing about the transformation program, the next generation facilities, the use of advanced technologies like AI. Clearly, you have introduced some remarkable change in the organization in an industry that is not really known as being among the forward thinking in industries. I better put a laggard in technology adoption, I think. And I wonder what have been the most useful methods or your pathways to make the case for the use of technology where appropriate that has allowed you to make some of these tremendous advances in recent years.
Yeah, to be honest with you, some of our past mistakes, recognizing and learning from our past mistakes, I think it's not difficult to get teams, especially at a leadership level, to want to invest in technology. I called out bright, shiny objects before. We actually say no more often to bright, shiny objects than we ourselves introduce a new capability. Now, when you focus on the people and the process, and I have the benefit of having been responsible for the technology integration for the organization once we recognized that we were an 11 hospital system, a 450 practice organization, and not a 2 hospital system. I had the benefit of working with all the senior leaders, all the COOs across the enterprise, and got to learn from them what mattered and what didn't, and what aligned and what didn't. And so making those philosophical adjustments as a technology leader has helped me considerably with any future recognition of opportunity. Forget about implementation, is just the opportunity. A lot of the work that we do today is primarily people and process. And I joke around with my team that, I haven't been a technologist in a decade.
I like that. That's really interesting. You know what? Fascinating thing about your career is that you've spent essentially all of it at this organization, and so all of the change that you're talking about, you have been witness to. It's remarkable to think. I mean, you began as a workstation coordinator and a network analyst. Now you are now the chief digital and technology officer. You've been a chief since for the past 7 years or so, beginning as chief technology officer before getting the digital role as well in 2021. But you have seen it from bottom to top this organization, now leading it. And I wonder, what are some of the advantages of a nearly 3 decade tenure in an organization like yours, now in the leadership position that you have?
Sure. Well, I mean, I had the opportunities to see the organization change and grow. The reality is I've been with the organization 29 years, started as a volunteer. It's been phenomenal. I've had some of the best mentors imaginable, but we are not the organization we were when I first started. When I first started, I actually started on the Columbia Presbyterian Medical Center side of the house. We were one hospital with one structure, and we happen to be very close with our Columbia University partners, and we've evolved time and time and time again. So while it's, yes, 29 years, almost 3 decades at the same organization, the amount of change that I have seen is remarkable. And at the same time, the partners that I have had in the last 3 decades have been phenomenal. And I would not change any of it.
No, it's fantastic. A really interesting perspective. As you point out, it really isn't the same same organization today that it was when you joined 29 years ago. I wonder, we've talked about a number of remarkable trends that you're taking advantage of. Are there any others, Leo, that particularly excite you as you look to the future that you would call out?
Yeah, absolutely. One of the things that we're going to be seeing certainly in the next 2 to 5 years, and clearly in the next decade, is the fact that consumer grade medical technology is at the point of reaching good enough. And the significance of reaching good enough for any technology, if you think about what happened with Kodak and photography, if you think about what happened with Uber and the moment that communications capabilities were ubiquitous, that good enough stage for any technology changes the prospects. And so when I think about what's coming down the pike, as an example, that consumer grade watches potentially being leveraged to monitor the health of our patients, regardless of where they are. And having that capability, whether as a system or as a program, to see our patient, monitor our patient, and then tie that back to what I mentioned before, those early warning systems that I shared with you that a lot of organizations are working on. So now you have consumer grade technology, our patients are wherever they are. You have early warning systems that are now absorbing and consuming all the data being generated by our patients. And you can see a day where you've democratized healthcare regardless of where you are, whether you have physical access to a major entity like ours or a community hospital, or even if you don't have any of those, being able to get some support, some clinical support as a patient or customer or just as a human is incredibly exciting for me. And so it's something that I'm tracking very, very closely. We've seen that time and time again in other industries, and it's really transformed, disrupted those industries. And so helping my organization prepare for that level of disruption that's coming again, the real disruption is probably 5, 10 years out, but those capabilities we'll begin to really see in the next 2 to 5 years.
That's fantastic. Giving us all something to keep our eyes open for as things progress. I wonder, Leo, as if there's anything you've recently read, watched, or listened to that you would recommend to others. Clearly, you're somebody who remains abreast of trends and does a lot of thinking about how advances in technology might impact a business like yours. I'm curious, what are some of the things that you've been reading or watching or listening to that have you particularly excited?
Sure. I mean, look, the reality is all the old reliable books for me have been a great source of knowledge. As a leader, I would probably recommend to your viewers and listeners, Simon Sinek, really anything Simon Sinek, whether you watch it on YouTube or, I would recommend start with The Why as the book to read. Malcolm Gladwell, Outliers, is a phenomenal book because it really changes your perspective on just about everything that you do and know. And he does it in a data-driven way, which is was was life-changing for me. Thinking Fast and Slow by Dan Kahneman was another book that I felt was incredibly life-changing and certainly philosophy changing. And then closing it out with Black Swan, The Black Swan. I think, those books really help drive my philosophy. And anytime that I think I know something, I find an author that re-educates me and helps change me a little bit in an incremental way.
Great suggestions all. Appreciate you sharing those, Leo. And thank you more generally for a great conversation. Inspiring to see and hear about the work that you and your team have done, in your case, across nearly 3 decades, with a remarkable, vast, complex, and fast-growing organization, especially during your tenure. Thank you for sharing some of the insights from that experience. It's been a great conversation.
Thank you so much, Peter. It's been a great conversation. Always excited to share some of my views and some of the work that me and my team have done over the years. So thank you so much.
No, a great pleasure.